Let's do a little spinal articulation. We're going to do a spinal roll. Head, neck, and shoulders really nicely soften, resting on the floor. Ease through the base of your ribs and your belly, feet planted on the ground with whatever space is comfortable for your knees. We're going to do this as a real abdominal driven, back relaxed peel up. So start with just do the tailbone curl. Nothing else is going to move. You're just thinking about rolling your pubic bones towards your bikini line. Your ribs are still, your belly button is not really moving. Your upper abdominals are not the drivers here. It's just getting into those low abs. You're not bringing your butt off the floor yet. Just a little articulation of your pelvis relative to your legs and your spine. If you are really stiff and snug in your back, you might feel some objections in your lower back as you do this. I would encourage you to give it a try. This is a very tiny motion. You can do it as small as you need to, but use it as your entryway to getting your body to accept a little bit of movement that will help it to become more pliable. And that might take 3 or 4 rolls. It might take 20. Play around with it. And this might be as far as you go. But if you feel like you get to a place where your lower back is no longer registering an opinion, and it feels like, oh, okay, this is pretty smooth, then you go a little higher. You can still drive this almost entirely with your stomach muscles because you're still not going very far. But now you're thinking pubic bones to bikini line to, hip bones. Depends on where you wear your bikini, I guess. Roll and release. And again, you might do 3, you might do 30. And then increase your roll again. Still trying to go as far as you can, just using your stomach muscles. There does come a point where your legs and hips have to kick in. Physics just says you can't do all of this with your abs. So curl, 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 curl when you need to. Press into your feet. Find some hamstring and some glute. You just keep gradually increasing, and you're not moving to the next part of the roll up until your back feels very fluid and happy with the original length of roll. The highest you need to go with this one is the tips of your shoulder blades. We're keeping your collarbones heavy on the floor. We're keeping the tops of your shoulder blades heavy on the floor. You might come up into a nice big long open line from your knees to your chest. You might stop much lower. This is all about finding a place where your spine can roll comfortably and fluidly. It's not about finding a particular arbitrary height or place for the shape. So if you're rolling all the way up, great. If you're stopping here, also great. So then let's think about the rolling down, because it's not uncommon to pay lots of attention to the roll up and then just kind of flop out of it. So you're going to peel up, same attention to finding each individual vertebra. It's not really how it works. That's just an image. Everybody has sticky spots and your vertebrae are in different curves, so they do move very differently. But for the purposes of this discussion, when you're coming down, try to imagine bringing each vertebra down at the same time in the same way you tried to bring them up at the same time. And you'll feel the parts that you are inclined to skip. And our goal here is to notice those sticky blind spots and move into them on purpose. So use your lower abdominal muscles to roll up, roll up, roll up, keep rolling, hips and legs kick in. Come up to the tips of your shoulder blades, pause, and then bring your collarbones down first, even though you didn't actually lift them. Bring your shoulder blades down second, even though you didn't actually lift them. Just put a little extra weight there. Come down through your rib cage, but keep your pubic bones rolling back towards the wall behind you. Your curve in your lower back will become more pronounced as you roll down from the top, through the mid back, through your lower back, to your pelvis. And voila. One of the things that I really like about this particular sequence is that if you have a history of back pain, it's not uncommon to really feel like all back sensation is a danger signal. So moving really slowly and giving your body time to adjust to just a little bit of sensation, to just a little bit of pull, and feel it gradually decrease as your muscles become more responsive and pliable, as the fascia moves and hydrates and becomes more responsive, as your nervous system acclimates and adapts to the movement. Then theoretically, what happens is you can become less sensitized to those feeling messages and better able to determine what is in fact a pause, stop, hold signal, and what is just a message that says, oh, there's feeling here, but it's okay. It's just a sensation and we can move gently through it. Part of the key is always maintaining that kind of 1 or 2 or 3 out of 10 sensation and doing it often enough to determine, is that sensation going to decrease, or is that sensation staying the same, or is it increasing? If it's decreasing, you can move on to the next thing, and you gradually get stronger and more mobile and more pliable and more confident, and you can do more with your body, your back, and your life. Follow for more.